Hey guys, just wanted to show you what I have going on today. I'm working at a dental health facility today, getting their floors all spiffy. So it's a bigger one. It doesn't look big, but it kind of is. So we got a little stuff here. This looks like salt damage on the floors we'll have to work out. Typically with the salt, you want to use not an alkaline cleaner, not a neutral, but a little bit of an acid. The acid kind of breaks up the salt so things can get out. But this is a luxury vinyl floor, so you got to be really, really, really careful with acid. So we don't want to go too far, down on the pH scale, but maybe about between a 4 and a 6 should be okay, and then we got to neutralize it. Anyway, so what we're doing today is these vinyl floors here, all these carpets, so it goes around. It's like a big square, and then there's a bunch of stuff in here and everywhere. We're getting around here where people enter. Same thing. You probably can't see it, but there's a bunch of salt damage here. They have rugs, but the salt kind of seeps through the rugs. Same in the waiting room. You'll have it around where the feet are, all around here, and all around where the receptionist is. Some more carpets through here. We're doing all of these, all the carpets, all the floors. This place is beautiful too. It's one of the nicest dental facilities, honestly, I've ever been in. It's amazing. They keep it so clean. So it's impressive. But anyway, going down here, look at all this stuff. Doing all these floors. So we got a little tricky situation. So the people who, see, I'm working directly in here. Before they had this place in, the people who painted drip paint kind of all over the floor. You can't see it, but I'll show you a little close up here. You might not see what I see. See these little dots here? It's all little paint marks. And we're going by hand right now, getting all that paint up, because really, sometimes the old tried and true is the way to do it. I'm old school. We could sit here and scrub with machines all day, and it doesn't do the same as getting it on your hands and knees with a brush and some towels. But anyway, this is the work we have going on, and we'll be here all day. When we're done, maybe I'll put an after video in the comments here for you all to see. But hope everybody's having a wonderful Monday, and again, thanks for all your support. And if you have a medical facility that needs help, give us a call. We do everything between the floors, furniture, and then even the light fixtures. We could pull those up, clean those up, go around your pictures. Everything will get cleaned. Head to toe, walls, above your exit signs. These things all around, everywhere. Nothing gets missed. All right. Take care. Bye.